important question because this is a concern for most cosmetic surgery patients or all surgery patients. It starts with precise surgical technique in the operating room from your surgeon, making sure that everything is very neatly, meticulously done and closed in layers from the bottom up. I like to close with many layers from the deep structures all the way to the top so that the wound is closed slowly from the bottom like this. So even if there's like 1 or 2 stitches that happen to come undone at the top, you're not going to know because there's a lot of strength underneath. That's for me to worry about, not for you. After surgery, it's important to also minimize excessive movements. For example, with breast surgery, I advise my patients not to lift their arm above shoulder height because if there are incisions on the breast, lifting, stretching can stretch out the skin and the incisions. I like to tell my patients the body is healing over the course of 6 weeks and the strength of the scar increases by about 10% for each week. So if you think about it, at 1 week, there's only 10% strength of that scar. So even with the best sewing, best everything, if you happen to have a fall or someone pulls you and something's stretched out, then that can disrupt the scar. So it's very important to follow the post-op instructions, minimize any excessive pulling or stretching of that body part. It's important to, in the beginning, if it's okay with your doctor, make sure that any scabs are gently removed or scabs don't form on the incision. So I like to advise my patients to use very dilute 1-to-1 ratio of hydrogen peroxide with saline and a sterile gauze or Q-tip to gently clean the incisions to make sure there's no scabs forming. Depending on your doctor, he or she may have something called steri strips, which are little tapes that help reinforce the closure from the outside as well. Silicone scar gel is excellent at promoting great scarring by keeping it nice and moist and keeping it nice and soft. Whenever you're okayed by your physician, that would be a good thing to consider. And in general, making sure that you're eating very well. Some people think that surgery might be a chance to lose a few pounds because you're not doing too much, but actually it's the opposite. You have to make sure you're eating extra protein, particularly so that you can heal your wounds. All of the work that was done inside requires more protein to heal everything. So if you eat well, sometimes I even advise patients to take Ensure supplement or protein shakes just to make sure that they're healing from the inside as well. And along with the silicone scar gel, it's also important to do scar massage. Scars are healing, they're creating collagen to try to heal the wound, but the scar tissue is not very intelligent and it's just going to try to make any kind of collagen to try to heal the wound. And sometimes in certain areas that might be upwards and outwards against the skin, which we don't want. So if you do firm pressure into the scar, that will tell the scar cells to not grow in that direction, and that's not needed of them, and that also helps with scarring. Also, scars can be sensitive to sunlight for up to 1 year, sometimes longer. Patients who happen to have darker pigmentation will be more sensitive to darker scars, and so it's very important to wear sunscreen, silicone scar gel, or just cover it from the sun for at least a year. That'll be the best thing.